Good morning, everyone. Welcome in to the Morning Medical Update. It is Monday, January 31st. Thank you so much for joining us here on Facebook and on YouTube. Today, nothing worse than the loss of a child or the loss of a pregnancy. For one woman, this happened to her during COVID. She was 20 weeks along and COVID positive at the time. She shares her story, how she's working through her grief, and of course, her message to pregnant families now that a vaccine is available. Plus, Dr. Marc Parrish, director of our maternal fetal medicine program, he's going to get us up to date on what we are learning about the effect of COVID on pregnant women, their babies, and what effect, if any, the vaccine has on them. Dr. Stites is also with us today to talk cases, numbers, and what he expects to occur over the next few weeks. So please get your questions sent into us on YouTube, Facebook, and on the Medical News Network. You can find links right there on your screen. But first, let's get to our COVID count with Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson. Any good news coming out of the weekend regarding the numbers?
I think there is good news as far as total active infections. We did see a decrease a little bit at the end of last week. We've continued to see that. We are kind of sitting at the century point right now for active infections. So 100 active infections, 20 in the ICU and 11 on the ventilator. We still have, though, 100 in that recovery period. So a total of 200. But I think overall for the active infections, we are going down. We should also note we have had 53 deaths now in the state in the month of January. So that is not good. But overall, hopefully we can continue to see a decrease in our hospitalized cases.
Yeah, we just want January behind us, right? Isn't
Right.
that it? I think that's really the key. It's nice. We got down 198 or 199 yesterday. That was like really good because we were below 200, but still a little high. Can I show my graphs?
Yeah, go ahead.
All right, there's a couple of graphs I want you to take a look at. There's some national data, and then there's the Kansas data. We know that nationally SARS-CoV-2 is starting to drop. These are the cases now reported in Kansas, and Missouri's graph looks very similar. But you can see that the drop, and this is throughout the entire pandemic. Just a couple of teaching points. There's three major surges on here. Now, the reality is there's been some mini surges. If we honed it on this graph, you can see them a little bit better. But there was the one last fall and early winter. Then there was one earlier this year, and then there's this one. Look how much higher the total number of new reported cases has been against any other time. If you look down below the graph, you can see at the lower part, you can see the number of tests being done, the number of hospitalizations, the number of deaths. Hospitalizations have still trended up overall in the state, but there's a little hook in the curve just at the end of it that would make you say, okay, things are starting to get a little bit better. Let's go to the next slide. This is this is the hospitalization curve blown up into different age groups. You can see every age group went up, but every age group is now trending down just slightly. This is for the entire state. I think that's really good news because as the cases have dropped, now hospitalizations are starting to drop, and we hope soon thereafter deaths will start to drop. You look at the next one. I believe that should be the number in Missouri. Same story. Things are starting to drop. So, I believe that with this, we are going to see a little bit of improvement. And Hawk, there's some talk now about this stealth Omicron. The reality is that's just a slight variation of all the other of the original Omicron. I don't think it's anything to be that much more concerned about than what we've had before. But I think we want to keep an eye on it. Here's what I know: if we can get people vaccinated, and if we can keep people trying to follow the good rules of infection control, I think we could be in for a pretty good spring. But that is, unless there's another variant, I don't think the stealth variant is going to be that much of a concern beyond Omicron. What do you think, Hawk?
Yeah, I would agree right now with the paucity of data, with the little amount of data that we have. If it's still an Omicron, we know that really Omicron's basic advantage is having that spike, which is just kind of changed to evade those antibodies that we have circulating for infection. But we know for disease, we know the vaccines continue to offer very good protection. We know that possibly previous infection offers protection as well against hospitalization and severe disease and death as well. So I think overall, I would agree with you, Steve.
We're going to cross our fingers. We still got to do a good job on the rules. Don't flaunt the rules. You know what happens when we flaunt things? They don't go well. I don't flaunt well. And then we start doing something like what happened to the Chiefs in the second half. I had to make one reference to that game in the second half. The first half, yay, second half. Oy vey.
You feel a little
But-
defeated this morning.
Yesterday I went home, I kicked the dog. I don't really have a dog. I just kicked the door or something like that. I may have thrown something up against the wall. Not really. But I felt like it. And
Did you get your workout in this morning? Get some aggressions out?
I tried. Yeah, I got here really early, had to round. So, here's the thing. We'll be back next year. Mahomes is still the best quarterback in football. Andy Reid's still the best coach in football. We'll be okay.
Okay.
There you go. Just
Okay.
like
We
Omaha.
did need it.
Well, we're going to be okay.
We need
Silver
it.
lining.
The silver
Yes,
lining, but it was
Lin-
painful to lose to the
Lindsay,
Bengals.
did you watch? I know
Yes.
we texted last night and you said,
Yes.
"Oh boy, you go. I'm coming on the show on a Monday
On
and right after the
Monday.
Chiefs lose."
Nobody's going to be in a good mood. On top of
No.
that, it's a Monday.
It
But
is,
we're going to
isn't it?
find good. with
We
the
are going
bad.
to find
We're
good.
going to find good with the bad.
Yeah, I
All
like
right. Okay. So just real quick, do we have any reporters on the line today? Don't think we do. Okay, we're going to get to our community questions here in just a few moments. But again, I want to introduce you formally to our guest and our colleague, Lindsay Taylor. Lindsay's going to share her story with us today. She lost her baby girl, Marin, in November of 2020. You were 20 weeks along at the time. Take us back, though, to the moment you found out you were pregnant and now you were COVID positive.
Knowing even a year ago that the vast majority of pregnant women having a COVID positive test, knowing that they wouldn't have complications, still did not eliminate the fear for me, and did not eliminate all of the ways in which we had to navigate finding out that we were COVID positive. And specifically with my case, I didn't have the best track record, and I had 3 previous miscarriages prior. And so I remember within 24 hours of getting a COVID positive test, I started experiencing physical pregnancy complications. And so after communicating with some very brilliant people here, I immediately drove myself to KU and was surrounded by doctors and our nursing team to then finally searching what felt like for hours, letting me know that they could not find a heartbeat on Marin.
And they did this out in the parking lot, Lindsay,
Yes.
right? What was that
At
like
first
to
they
be?
did,
I mean,
and
this
then
was
they
about
brought
This
height.
is early in the pandemic.
Very
Let's
early
just point
in
out
the
it was
pandemic.
really early. So,
Yeah.
Very early in the
Oh,
pandemic.
ouch.
And so I remember, hearing those words, I've heard them before, and hearing those words, the emotions that feel, overwhelming, that they flood your heart and your soul. And it was unfair. That pain rips deep. And I just wanted to get back home and be with my son and my husband and pick up where we left off that day. And there's another layer of this that I think is important to talk about, which is as a mother, knowing that your baby was struggling inside of you and knowing that there was nothing you could do to save her. You didn't know that she was struggling. You feel like a failure. And you feel as if you robbed your family of a gift.
And Lindsay, more and more people are talking about the pain of miscarriage. It used to be something people don't talk about, and now it's something that I think people are talking more freely about. And when we hear stories like yours, I think it helps women to know that they're not alone. But I mean, you were in the ultimate alone as far as your family goes, because they weren't allowed to come in, they weren't allowed to be with you. I know you had your work family here, and I know you were so grateful, so grateful for that. But you were fearing for your own life. I mean, you were talking about the loss of Marin, and you wrote something, and I kind of, if you don't mind, I'd like to read the post that you wrote. It says, "I remember mumbling, 'Am I going to die?' after the doctor who put her hand on your arm during this risky time and said that being COVID positive, to undergo intubation for a D&E, that could ultimately result in being put on a ventilator and never coming off. The safest option for me was to labor my 20-week-old baby girl." So COVID took your options away.
Right, exactly. And another layer to that is they felt that, again, they don't believe that Marin passed because of COVID. They believe she may have passed a couple days prior to receiving a positive COVID-19 test, which was a whole other risk because of infection. So they feared that, not knowing for sure when Marin had passed, I could have an infection. On top of that, and I know Dr. Parrish probably can say the better medical terms for this than me, but I was in my second trimester. And so within your second trimester, your placenta becomes sticky. And if you were to deliver in your second trimester and the placenta would not come out, that would also pose a risk for having to be put under and being intubated, and then they feared that, I would then have to potentially be on a ventilator in the ICU and never come off. And so the way that they shared these options, and I say those specifically, the complexity of that is because it's a testament to the important work that our team does here. And although it was unfair, and although it was sad and painful, I did have confidence even though I was alone. I felt like they saved my life. Although I didn't want that was my last resort, right? I didn't want to do that option, but it was the safest for me.
Well,
So which option did you pick?
Obviously, I delivered Marin. And the placenta did come out, and so we obviously prayed for that, and God did answer prayer there.
And I think we have a picture of you in the hospital.
I
so we can pull that up. And it is very
yes.
heartbreaking, but it just, I think it's very real. And I also think that, you talk about, we talked about listening to our doctors, and I think
Yes.
there's no better time. And Dr. Parrish, I want to get to you here in just a moment, because when we talk about listening to our doctors, I remember when my doctor said I need to get a flu shot, and I said, "Are you sure?" And I was really nervous, but he said, "You are absolutely 100% getting your flu shot." And I remember that feeling of going, it didn't have to come on me to make that decision.
Right.
He made me feel like, you're getting this, and I knew that he knew what was best for me.
Yes.
And we're just so hoping that people hear a story like this and say, listen to your doctors, and follow their lead.
Yeah, and I would just piggyback off that, Jess, because had the vaccine been out then, because a year ago, it wasn't out.
No, you were
and if
before.
if my doctors here recommended for me to get that vaccine, I would have said, poke me now.
Right.
And the reason for that being that I get the opportunity to work, I know on the technology side, but I get the opportunity to work
counts. It's all part of the
very
team.
closely with our providers and our nursing team. And I see what they physically devote their lives to taking care of us, taking care of you and me, and really the entire nation. And even more so, the devotion of bringing us the most accurate information regarding the pandemic, and whether you're pregnant or not. And having their advice is enough for me to get the vaccine.
And I think early on, though, that was tough to do. And I say that all the time.
Well,
Dr.
well,
Seitz.
we can go back talk to the early part of the thing. There was such controversy about whether you can recommend vaccine during pregnancy, and even when we put our vaccine mandate in place for our vaccine plan for our employees, we didn't recommend it. We didn't. We left pregnancy as an exemption because at the time the FDA said we don't know what this means, and so we didn't feel comfortable. I mean, there's medically, we all recommended it, but for an employment rule that we couldn't do it. Now we do, because it's clearly changed. And so Hawkeye, the story has evolved over time.
Mm-hmm. Yeah, and we should say the professional organizations, the College of Obstetrics, they all were at the forefront in recommending it. But just like you said, yeah, I mean, we wanted the data. We all believed and knew it was safe. It was just a matter of those other things for sure.
Dr. Parrish, you're the expert here. What are we learning? Back when Lindsay had her experience to now, what have we learned about the effect of COVID on mothers and babies?
Well, first, let me say, Lindsay, you did a fantastic job of walking through medical terminology that was translatable by the community, so I can't do a better job than what you did. I also want to extend my heartfelt condolences for your loss of Marin. It's a very difficult thing to have gone through the pregnancy losses that you've gone through, but at 20 weeks, when you get that far along, it's even more difficult. And on top of that, you had to navigate that very difficult journey, as you very well illustrated, through a pandemic when we didn't know much at all about the effect of the virus on pregnancy and what it could do to your system and the risks that it had to you. We have fortunately gained a tremendous amount of information, not only with just on-the-ground experiences with the COVID virus in pregnancy, but we actually now have data to back up what we were seeing anecdotally. And so part of that comes from the CDC and also from other population-based studies that have been recently released around the world. One of the more recent ones was from Scotland that showed several important points. One, in those moms that were vaccinated, they saw much less adverse outcomes in pregnancy compared to those moms that had not received the vaccination. So for instance, moms that did not receive the vaccine in this Scottish population had higher risk for preterm birth, had higher risk for having small for gestational babies or babies that were growth restricted. They also had increased risk for maternal deaths. And so, those are important things that we have continued to gain more information about. The other thing that is important to note from our CDC data that was released, I believe, about a month ago, that involved 40,000 mothers that had received the vaccine either right before or during the pregnancy. That study demonstrated that there were no risks for adverse outcomes, including preterm births, stillbirths, no increased risk for growth restriction, and no increased risk for congenital anomalies or birth defects. And so, both of these studies and many others that are out there have just continued to strengthen what we were seeing. That being that if you were pregnant and you unfortunately acquired the COVID virus, that you would become much more ill than a mom or a equivalent mother that maybe wasn't pregnant, same age, same health status, but that mom that's currently not pregnant versus a mother that was currently pregnant, because of the pregnancy effect on the physiology of the system, it blunts your immunity. And so you get any type of virus, you become much sicker. And that's what we're observing, both with the Delta and currently with the Omicron. And you became even more sick if you had not received the vaccination. And that's the data that we're fortunately getting in front of us now, that we can provide to our patients and get out into the community and just stress the importance of getting vaccinated, and that there should be no fear to get it while pregnant.
Yeah, so it's what we thought to be true to what we can pretty much confirm to be the case as far as safety with.
Yeah, I don't think there's any question anymore, and now we absolutely recommend the whole spectrum of vaccination within pregnancy. Hawkeye, we know that it's much safer to be vaccinated than not, despite all the hue and the cry from people who may be anti-vax or vaccine, really trying to deny some of the facts around it. And they look at VAERS and other sites. They say, look at these terrible things, but the reality is that vaccine is safe and it is recommended in pregnancy. And we know that women, just like with influenza, vaccine clearly recommended for influenza, vaccine clearly recommended for COVID-19 while pregnant, and especially while pregnant.
Yeah, that's exactly right. We know the safety. We know the benefits as compared to the very little risks, and I think both you and Dr. Parrish have stated that very well.
And Dr. Parrish, you've always said that the health of the mother is key to the health of the baby. So when Lindsay was mentioning when she was pregnant with Marin, and they said that she may have to be intubated, and that might make her fare much worse if she's COVID positive and put on a ventilator. Kind of explain that to us, because again, that hits home, I think, for folks who are questioning whether to get vaccinated while pregnant.
So I think the concern there was, we knew that that the COVID virus would have a tremendous effect on your lung function, increased risk for pneumonia. And, oftentimes you've got to battle situations in pregnancy where there's a lot more swelling in the upper airway that's just naturally there because of normal, again, physiologic effects on the maternal system. And so I think that part of the concern was just once if you, Lindsay, would have had to have become intubated, that she may not have been able to come off, or it would have been longer that she would have had to be on the ventilator, just because of the physiologic effects of the pregnancy. So again, we know that vaccines decrease the severity of the disease process in pregnant moms, and we do not see moms that are pregnant that have received the vaccine but also then have a breakthrough infection with COVID. we're not seeing them get admitted, not nearly as frequently. And in fact, even if they were to get admitted, we're not seeing them have to go to the ICU. It's oftentimes just monitoring closely. But, you know, in that situation, I think that obviously this is an understatement, but irregardless if you're pregnant or not, if you're not ill enough to be hospitalized and or to have to go to the ICU, you're going to fare much better. And this data that we continue to collate and see, you know, not only on the ground in our own anecdotal or personal experiences, but also what continues to be published in a prospective manner here, it just continues to solidify those observations and again, just nail home the point that getting the vaccination should be a priority. And you know, I always have been beating the drum since day one that if you want to protect your baby, then protect yourself first. Mm-hmm. And by protecting yourself, you're going to get the vaccine. By doing so, you're going to protect your baby as well.
And if I just may add, the other reason not to intubate people at any time, but even in, especially early on in the COVID crisis, was that we know that when you go on a ventilator, we have to push air into your lungs. Normally, when you take a breath in, you suck air into the lungs. That's two very different things. And so when you push air in the lung, you having to use force to do that, as opposed to creating this negative pressure in your lung. When you take a deep breath, you suck air in. And so when we do that positive breath, when we put the positive pressure into your lung with COVID-19 and in pregnancy, you can cause a lot of lung damage just by the way you have to do ventilation. And the fear is that in this setting, especially earlier on in the COVID pandemic, when the alpha and the original strains were more predominant, and those were actually more severe for ICU outcomes and death, then what we knew was that putting you on the ventilator was in and of itself a risk factor. COVID, even if you didn't have terrible pneumonia, was still in your airway. We could actually make the inflammation and the damage from COVID-19 worse and worsen your chance of survival. So people didn't want to have to use the ventilator in patients then. We don't want to have to use the ventilator now, but it was really a critical issue back at the earlier days of the crisis.
Thanks for pointing that out. All right, so let's get to some community questions because they're coming in and they're pretty good ones. And the first one is from Isaac, and it's for Lindsay. Just curious your reaction about people refusing to get vaccinated, maybe concerned about infertility issues or the effects on a pregnancy. Have you had to navigate some of those questions when people hear of your story? Do they then start, asking you questions and wanting to know your thoughts on these type of topics?
Yeah, of course. And I'm glad they do ask me. Because I obviously agree with the vaccine. I will obviously celebrate it that we have one. But I think hopefully my experience is a testament to wishing that there was a vaccine. I think that if you are, first and foremost, if you are nervous and you have questions, that's obviously okay. Consult with your doctor, ask the questions you have, and then ask more questions after that. Until you feel comfortable and confident in receiving that vaccine based on their recommendation. Because again, I physically see how you all are navigating this and how you are bringing the most accurate information to all of you. And for me, that is enough. That is enough of a solution for me to get the vaccine.
Makes sense. Karen wants to know, and Dr. Parrish, are you requiring or asking pregnant women to get a booster?
Yes,
requiring,
absolutely.
But suggesting.
The answer is yes. We're recommending strongly that pregnant moms that are eligible to get the booster, that they get the booster. It's definitely proving again, anything that you can do to strengthen your immune defenses against this virus will make sure that you're staying out of the hospital, but also ensuring that you have a healthy pregnancy outcome. So, long-winded answer, but to that, but the simple answer is absolutely.
And Hawk, we're recognizing too that on the booster question, after 5 to 6 months, you really do need a booster, whether you're pregnant or not.
Yeah, absolutely. And there was a new MMWR published, I think, late last week that did show an improvement or reduced rates of people coming to the hospital for medical care for COVID-19 if they did have that booster shot. And again, I think really what the main point here is it's that time from that second dose until you have that booster that allows your immune response, your B cells and your T cells to develop. That booster dose then really puts that to the forefront and really explodes or increases that response. So I think we are seeing now clinical evidence and reported evidence that it does help reduce your chance of going to the hospital with that third shot. So that's why it is so important.
Carol wants to know, can someone keep testing PCR negative and still have COVID and still be contagious?
I think really what we need to look at is not so much testing, but it's that time from symptoms. And really, since early on in the pandemic, we've had very good evidence and data to support the fact that if you are mostly in that 8 to 10 days from when your symptoms started, you really should not be infectious. So I'm not sure exactly when this person is asking the question. Is it during the first couple days of symptoms? I think we really need to focus on the symptoms onset and just understand that you were probably most contagious 1 to 2 days prior to symptoms, to about 2 to 3 days after symptoms start, and then it does decrease from there. And really by about day 8 or 10, you really should have little to no infectious virus or be a risk to other people.
And just to say, like with the patients that I'm following, the ones you follow, after 10 days, we remove you from the COVID unit. We put it back on the floor. The precautions get a little better because we know that really you're not infectious at that point to others.
All right, Karen has a question. Dr. Parrish, she has a 17-year-old daughter continuing to have irregular menstrual cycles after receiving the vaccine. Are you concerned about receiving further vaccine? Can you address that?
No, I would not. I would say that you have to be careful with saying that is there a true association, and if there is an association, is there a causation? I can tell you that the data that we have to this point about any women of childbearing age that are receiving the vaccine, that it should not have an adverse effect on fertility. And that would mean that it should not have an adverse effect on cycles. And so I cannot say with 100% confidence that the vaccine resulted in your daughter having irregular cycles. But I would say based on the majority of data that we've seen thus far, it does not appear to be something that we're concerned about. And so certainly that could change as we continue to gain more data, but we have like I said, up to, it's over, it's thousands of data points, not only here in the U.S. from the CDC, but from other countries. And that's not been something that's been reported.
Can I tell you, just to pick up on that, and Hawkeye can talk too, because I know we've given over 100,000 doses of vaccine here in our health system, right? 100,000. That's approximately a lot. And in all those doses, we're just not seeing all these terrible things. I didn't grow new teeth or no hair. I don't have a lot of hair, but that's been a long-standing problem, and that developed before COVID-19 and vaccination. My kids did that. But the reality is that the vaccination is just not associated with this litany of effects that people want to make up about it. And the problem is that sometimes they'll even quote back at us the VAERS, this vaccine adverse event reporting. And when you look at it, the question is, are there things that happen to people who get vaccinated? The answer is, well, of course there are, because there are things that happen to people who don't get vaccinated. And the question you have to ask yourself is there an increased number or increased frequency than it is in the general population? And if it is, what you do is you go take a look at those people and you actually study them. Instead of just relying on subjective, you actually go back and study these folks. And once you get into the studies, you look at it and you say, gosh, this is just not something that it's seen at the same rate in the general population whether you're vaccinated or unvaccinated. So it's not associated with vaccination. There's not a causation, as Dr. Parrish has pointed out. And so I think at the end of the day, vaccines, Hawkeye, they are safe. And you and your colleagues in your profession of infectious disease, you've been recommending vaccinations for generations.
Yeah, again, I think when you talk about overall childhood vaccinations, we know the benefits that they have provided to now couple generations of children, things that my parents had to live with or live through, that just the safety of them and the illness that they have prevented, and just kind of moving up through everything that we've talked about. We know that there are some misinformation campaigns that are either because of people wanting to give that misinformation, or just because of ignorance and not understanding the full data set. You know, it's a combination. But what we can tell you is that, is just as we heard Dr. Parrish talk about, we know the benefits and the safety of these vaccines overall. We know the benefits that they can continue to provide, and they have proven and shown to provide that, and we will continue to advocate for the use of vaccines.
So, you know, it's like this. Sometimes two things can be true. I wear the same pair of jeans to every Chiefs game. We always win. Mm-hmm. Yesterday,
what'd you do?
I wore a different pair of jeans because the others were really dirty, and we lost. Therefore, the jeans were at fault. No, they're not.
We were looking for someone to blame.
You can blame me.
You're a perfect
Sorry,
person
Patrick.
for that. Dr. Parrish, we have several more questions for you, but Lindsay, I want to bring you back into this conversation because it was brought up on the feed just about how you're managing the grief, and that's something that surrounds this topic very much so. So just what advice do you have for people who are facing grief like yours, certainly a loss during COVID, somebody of COVID? What could you share, and kind of what's that silver lining you were telling me about that you were finding?
Yeah, no, and I appreciate that question. You know, first and foremost, my faith has carried me all the days of my life, and it will from here on out as well. But grief definitely has a mind of its own, and it can feel very overwhelming at times. And I want you all to know that your grief is validated. Your loss meant something. It has meaning, it has worth, and give yourself grace to grieve. And it's okay to not be okay. You know, one of the biggest things for me, it was a turning point in my grieving process, was about 6 months ago. I came in for my primary care. And, you know, I thought I was okay, you know, and that's, again, grief has a mind of its own. And the doctor said to me, you know, we have a psychiatrist here on staff. If, you know, part of your visit you would like to speak to him. And I'm like, oh, you know, I got to get back to work. And I mean, only if they have time, right? And I'm so glad she did. And again, this just goes to show you throughout this entire process, you know, not just the medical condition, but also the emotional stability that KU offered me through this. They knew what I needed before I did. And listening to that psychiatrist come in, and the very first thing she said to me was, Lindsay, I want you to know that it's okay to not be okay. And if you were okay, I would actually be more concerned. And it was like, you know, it was like this release that, okay, I don't have to always be strong. You know, I don't have to just move on from this. And nobody wants to necessarily move on from their grief, but they want to get stronger because of it. And I've just learned from that moment on that continue to always see the good with the bad, and you will always come out on top.
When I talked to you on the phone, I asked you, I said, you know, I wanted to talk to you before you came on our program because I just wanted to know what you wanted to talk about and how you wanted to tell your story. And you said, you know, something that people don't realize is that when you don't talk about the person you've lost, it actually hurts more. So with that, I want to talk about, you said, say the name. So I want to talk about Marin Norma and the way that you are honoring her memory and helping other mothers. Tell everyone about Marin's memory.
Yes. I knew that my pain, I didn't want to waste my pain, and I knew that it wouldn't be wasted. And I had to give back. I had to help someone experiencing a loss similar to mine, because that also helps me heal. And so I encourage everyone to, find that good with the bad. But also, my incredible selfless friends put together a GoFundMe on Marin's behalf, and to provide swaddles to KU patients. Our goal is to provide one for every baby that's ever delivered here. And again, that's a lofty goal, but so far we have raised over 500 swaddles that we were able to give back to patients, and it has her little logo on there that my friend Caitlin actually designed on behalf of her. And this, what you're seeing here right now, I was able to give the very first swaddle to the patient and a little baby, in which the mother actually works on the unit. So that was even more spectacular. It is something that I will always hold near and dear to my heart. I'll never forget it.
So grief has been part of your process.
Yes.
Part of your process.
You know, my wife is an OBGYN. I know whenever somebody lost a baby, she was always in such pain about it. We have 3 wonderful children, and I can't imagine the hardship for you and your family, because this has been something not just once, but it's happened a couple times for you. How do you find your way forward?
Again, like I said, faith has always carried me through, Dr. Stites. But also, I wake up every day and I'm consistent. Consistent doesn't mean perfect. So there's some days I miss this, but and I try to be grateful. Start the day with gratitude, something that you're grateful for, even if all you can muster up that day is that you have a hot shower or that you're able to breathe and get out of bed. But start your day with gratitude, and I promise you it'll turn your situation, it'll turn your perspective around, and you'll see good through it.
Well said. Great advice.
That's beautiful. Yeah, great stuff.
Right, for all of
And
us.
we always say faith, hope, and science. That's the intersection. I think you've talked about that beautifully today. Better than I did.
A few questions left for Dr. Parrish since we have him with us. Karina is curious, what kind of increased complications for mom and baby has Dr. Parrish seen with pregnancy or deliveries since COVID? Any special cases, anything that's standing out to you?
So I would say the biggest effect on the pregnancy is how sick mom is getting. We've seen, unfortunately, we've had some pregnancy related deaths occur or have experienced those. Those are probably obviously the worst outcome. We've seen babies being delivered at the cusp of viability, or that's the point where there is a remote chance that they have a chance to survive outside of the womb because moms have become so ill. So what we'll see is moms that are being admitted to the ICU, requiring ventilation, requiring extra resuscitative support to keep their blood pressures up. When you start affecting the maternal cardiovascular system, pulmonary system, that has a dramatic effect on the pregnancy, because a lot of times the maternal response is first save the mom. The body is going to sacrifice any blood flow or oxygen that is getting to the baby, and so those are going to result in significant risk for stillbirth, can increase the risk for, as I said in these other cases, very early preterm births. So those are the things that we're really, that we see that are heartbreaking for all of those involved. We're fortunate to work at a center that allows us to have multiple subspecialists involved in the care of these moms, and we do see good outcomes in these moms, but we are also seeing these horrible outcomes as well, and they're preventable outcomes as well, as we've been harping on. I'm not seeing these things, and neither are my colleagues, in moms that are getting vaccinated. These things aren't happening. They're happening in the moms that are not getting vaccinated. They're coming in very sick, and if they're very sick, so are their babies.
Bridget wants to know, are you seeing a higher rate of gestational diabetes in women who are non-diabetic prior to pregnancy and unvaccinated who get COVID?
We're not seeing that effect. That's not been something that's been observed to this point.
Okay, I'm going to read Nadine's story, if you could help her out and give her your advice. My daughter is currently 9 weeks pregnant. She's vaccinated but not boosted. It's been 1 year since her second vaccine. She's had 3 miscarriages in the last 15 months. So she has not been boosted because they're trying to focus on her recovering from the pregnancy loss. Her fertility specialist recommends waiting until second trimester due to possible inflammation. She tested positive for COVID 6 weeks pregnant and now is wondering what to do about getting boosted. Lots to unpack there. What would your advice be for her?
Lots to unpack for sure. And I completely sympathize with the fear, especially when you've had prior losses. And then you're getting advice from your reproductive specialist that's helping take care of you. Truly, all of the information that we're seeing, so facts that we have that are evidence-based, peer-reviewed facts, in addition to just thinking of the biology of how the vaccine affects mom, how it could affect a pregnancy, all we're seeing is nothing but positive things. So my advice is that you get the booster, get the booster vaccine. There's nothing but benefit without any risks associated with it.
Dr. Parrish, last question. It's from Melanie. What, if any, additional precautions or changes do you make for deliveries of pregnant women that come in that have not been vaccinated?
So every mom that comes in, vaccinated or not, has to undergo testing, PCR testing. Obviously, if they're positive, regardless of vaccination status, it changes more for the employees that are taking care of the mothers. It changes the type of personal protective equipment that we have to wear. However, it does allow, let's say that we have, and I would say that we treat everybody the same if they're positive, knowing that vaccinated moms that are positive, we're probably not going to see them get very ill, but we watch them more closely for sure. We're monitoring for, let's say, things like they're at increased risk to have blood clots. And so oftentimes we'll put those moms on an anticoagulation agent to thin the blood to decrease those risks, because being pregnant and having being very ill with COVID can increase those risks. But also in that recovery phase after the delivery, there's a lot of times you're not up and at 'em. And so you're going to be a little more sedentary while you're trying to recover. And so, those mothers that are positive will get put on preventative agents to try to decrease risk for blood clots. And then we just watch very closely to make sure they're not becoming sicker while they're here with us in the hospital.
And Dr. Parrish, one thing, and I think you and Hawkeye can help comment on this. In pregnancy, in non-pregnant patients, what we hear is that after you've been infected, you have really strong immunity for the next 90 days. Yeah. So is vaccination still going to be recommended if you've just had COVID-19, or can you wait 2 or 3 months before you do it in pregnancy, Hawkeye, like we do in regular folks? So Dr. Parrish and Dr. Hawkeye, I'm just because we say we got to be careful. We say these things and I don't want to confuse our audience too much.
That's true. So Dr. Hawkinson, you can elaborate more, but I would agree in this the daughter that the mother was asking the question about if she had recently been infected, and I think you had said that. So I was commenting on the booster and advocating for the booster.
And a booster we got to do, but I want to make sure we don't confuse anybody.
Right,
so,
but I agree. We would say the same thing. I think 2 to 3 months. Dr. Hawkinson, I would assume that's the recommendation.
Yeah, I mean, it does get a little gray, just like Dr. Stites had mentioned. It can be confusing. We don't want to confuse. The recommendation continues to be from the CDC is to get your booster, and that there is no minimum time between getting infected and getting that dose of vaccine. So that is the clear definition. Also understanding, however, that you are considered to be immune, and now with Omicron really out there, you will have some immunity to that. You are considered immune after infection for about 90 days. So if you wanted to push off that booster or that dose for 60 or 90 days, I think that is reasonable. But we also never want to miss a chance to vaccinate.
All right, well said. We're going to get to our final thoughts now. Appreciate everyone's questions coming in today. Lindsay, just thank you so much for being with us and sharing your story and telling us about Marin and what you are doing to help other moms going through the same thing. So we appreciate that. Just what is your final thought? What do you want folks to know?
Well, the sun will rise, and it's our job to rise with it and show gratitude, give yourself grace, give others grace, and get the vaccine.
Great message. Thank you so much. Dr. Parrish, thanks for being with us and answering some of those questions today. Your final thoughts.
I just reiterate everything that we've said up to this point. Vaccines are safe to get in pregnancy. We're going to recommend that you get them during your pregnancy. It's going to not only allow you to protect yourself, but in the same vein, you're going to be protecting your baby. We also have that data that had come out several months ago that shows that babies that are after the birth, when babies are checked for antibodies in those moms that receive the vaccine during the pregnancy, those babies have antibodies for the COVID virus, for the COVID infection, against the COVID infection in their system. And that's an important protection for them. We also know that the antibody will cross the breast milk and provide extra protection to the antibodies that are important for protecting against upper respiratory infections. And so, not only are you protecting yourself by getting the vaccine, but you're also protecting your unborn child, and then you're also protecting your newborn from potential exposure to environmental infection that they could come into contact with. So, without a doubt, the evidence is a landslide in favor of getting the vaccine during pregnancy. Protect yourself, protect your baby, get the vaccine.
Dr. Hawkinson, final thoughts from you.
Yeah, and a lot of people were concerned because they were further out from their initial 2 doses of vaccine, and we have good evidence now supporting the fact that that 3rd dose really does increase that benefit of reducing your hospitalization risk. So I would just echo what our guests have said today and really get vaccinated. Continue to be up to date on your vaccine. If you're due for that booster, please go get that booster.
Dr. Stites.
It's the intersection of faith, hope, science, and as Lindsay has so beautifully pointed out, grace. And I want to say thanks to you. I think you've given us more faith and hope in humanity just by your expression of your grief and being here today. It's been beautiful, and I can't say thank you enough. And to all of you out there, please know that when we try to talk about vaccination, we don't have financial motivation. We really don't. We don't have, despite what people think or may say about us, we don't have any other reason. We're just trying to take care of you. The same thing we do every day when you come into our hospital and all your hospitals around our area. People are just trying to take care of you. And when we make these recommendations, we don't have any downstream benefit other than we'll have fewer COVID patients here. We all want that. Faith, hope, science, they can bring us forward because I think there's some really great days up ahead. I think March, April, and May are going to look really good. But the more people that are vaccinated, the better they're going to look.
All right, let's get there.
Let's do it.
Thanks, Dr. Stites, and thank you all so much for being with us today. Coming up tomorrow, you may have seen this woman on TV. Kelly Kidd suffered an unspeakable tragedy, losing her husband to COVID, but she's trying to help others avoid the devastation with a very public message. Her story is tomorrow, plus an expert with advice on how to begin recovering from a loss like that. We'll talk more about that coming up tomorrow at 8. We'll see you then. Have a great Monday.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.